So my name is Tunde Ojo. I'm a psychiatrist and I'm the national coordinator for National Mental Health Program at the Federal Ministry of Health and Social Welfare here in Abuja. Well, I think so. What else can I say about myself? So yeah, I think that's who I am. I'm a doctor of my MBBS, then did my training in psychiatry, where I'm also a global mental health expert. So I have my master's in global mental health at King's College London and the London School of Hygiene and Tropical Medicine. And I've been working as a consultant psychiatrist with University of Abuja, teaching hospital until 2 years ago when I was invited to the ministry to uh, come and lead the newly created National Mental Health Program. I think uh, I think that is who I am, and so um, happy to be here just to share some one or two things. Let's see how that can be of help to you guys. And okay, thank you so much for the introduction. Let me go now. Let's hope we just have some. I'll just make it as snappy as possible. Can you enable me to share my screen? Okay. Yeah, can you see my screen?
Yes, I can. Right.
Oh, okay. Thank you. Let me see. I wanted to be sure. Okay. So, we'll just have a quick talk on you and your mental health. And I saw on the screen that men's mental health. I think towards the end, I would just place some specific emphasis on while men's mental health is very important, why we need to talk about it and what we can do about our mental health. So, but generally, what I'll be speaking to is how do we address our mental health, be a man, a woman, but this is very generic, and then we'll just be posting them and mentioning some specific other. And I will use this opportunity just to speak generally about mental health so that our mental health literacy is increased, what the myths are around mental health, what it is, what they are not, and how we can enhance our mental well-being, and how to address the issue of stigma, which is a very big barrier to assessing mental health. And when we talk about mental health, before now, quite a lot of people, what comes to mind is treatment, or somebody that have mental disorders. But the truth is that is just very small part of mental health, as we will see in this course of our presentation. And so I will just be having a quick run through this following outline. We know what health is, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I know that we all know this, but that is very important to say that, oh, I'm not sick, so there's nothing wrong with me. Health is not just absence of sickness, but for us to be operating optimally. And it's not just about physical health, which is what people place so much emphasis on at the expense of others. But this is WHO definition of health, and look at it from all that angle: physical, mental, and social well-being. And so when we talk about health and we leave out mental health, then it is incomplete, because there can be no health without mental health. And when we talk about mental health, what is mental health? It's a state of well-being. Look at that, a state of well-being, which every individual realizes his or her potential, can cope with normal stresses of life, and can work productively and fruitfully, and able to make a contribution to his or her community. Look at those very operational words or phrases, a state of well-being, and that every individual is able to realize his or her potential. We all have potentials. And then when we talk about normal stresses of life, what constitutes normal stress of life? And it's not the same for everyone. How we cope with stress depends on our resilience. And so we will talk so much more about resilience later in the presentation. So it is how we are able to achieve our mental well-being and able to deal with normal stresses of life that can enhance us to be more productive. And it's when we are able to be productive that we can contribute meaningfully to our community. And when we say community, it's not just a physical space. As you people had the exam, you are a community. Where you work, your place of work is a community. Your family is a community. So in that regard. And so when we now talk about mental well-being, but with so much emphasis that has been on mental disorder, what is, when we say someone has mental disorder or people are going through mental distress, what does it constitute? Is it just one thing? What people see on the heart there, oh, someone that is walking naked, someone that is looking tattered, someone that is smoking India hemp and a lot of other things and behaving unusually. That is what people see as mental disorder. But the truth is, I like to use the word more of mental distress, which is a spectrum, just like we are talking about health, from all health to disease state. The same thing is about our mental well-being, about mental health, from very optimal mental health to distress. And then at the other hand, we can be talking of disorder. And you don't talk about disorder until when we say that what that person is doing is abnormal, is a deviation from the normal, and also it has is causing distress either to that person or others, and it has caused a dysfunction, not able to perform the function very well. And people can say, oh, what are the causes? And there are no single cause to mental distresses or mental disorder. It's a function or intersection of different causes, biological, psychological, and social. And none of them exist in isolation. They interact together. And if we are saying that who are the people that are prone to mental disorder or having mental distress, but you can ask me then, we say that who is exposed, who is vulnerable to stress? All of us are vulnerable to stress, but it's just what are the type of stress that one person can take can be different from the type that the other person can take. And just look at, just envision a Pajero Jeep compared with a B2 or a Toyota Corolla, or someone that is riding a G-Wagon, and they enter into a bump. The shock absorber will determine how the vehicle is able to respond to those bumps. There are big vehicles that they will just, without even slowing down. But there are vehicles that once you get to a bump, you have to slow down almost to zero. So the same thing is about our resilience and how we are able to deal with adversity in life. And that is where the theory of stress diagnosis theory comes in, that we are all vulnerable, but it is our vulnerability that differs, and that the interplay of our inherited vulnerability and things that happen around us. And so you will see some, and another example that I can use is maybe someone that can use, if you see someone, it may just be like 5 punches that will bring the person down in a wrestling fight. Whereas another person can take 30 or 40. But the truth is, can anybody at any time? It's just like saying that everyone has a price. It's just that it is different. So then we are all vulnerable one way or the other. In as much that you have a brain where your mind is seated, we are all vulnerable one way or the other. So it is when we have this understanding that we can play on what are the risk factors and lower them. And for every risk factor, there are also protective factors that can ensure our mental well-being. So like I have said that the causes is not one. They are biopsychosocial, biological, psychological, and social. Our interaction with our environment. And when we talk about our environment, the biological environment, the social environment, our society. And so no matter who we are not in isolation. And we see a lot, mental health is a space in which a lot of socio-economic factors can be either positive or negative, can be either a protective factor or a risk factor. All these economic hardship, unemployment, insecurity, pressure at the place of work, all of these have untold events on our mental health. Whereas where there is certainty, where there is good social connectedness, these are very positive factors, protective factors for people's mental health. Where there are good social amenities, these have been found out to be very positive, protective factors that enhances our mental well-being. And so just like I have said, that there is the interplay of biological, psychological, and social factors. If you see, like I put there, under the social factors, among many others, the peers, family circumstances, family relationships, significant others relationship, and coping. How do people cope under the psychological factors? Coping skills, social skills, self-esteem, and among others. So there are a lot of people that get into substance abuse, not because they want to go into it, but when they start having some challenges in their life, if they are not sure yet, maybe socializing is a positive factor, but you find people using using drugs. Oh, I'm just using it to distress, like people will say. And people that are also have self-esteem, that have low self-esteem, has been found to be at a higher risk of developing depression and anxiety disorder. So under the social factors, some of the factors that are risk factors are dysfunctional home, poor relationship with others, substance use, and not meeting with social expectation, and low self-esteem. I think I have mentioned this earlier.
Sorry.
Okay. Yeah. So if we're talking about social and environmental factors, now people that may be having some mental health challenges in their life, or you find out that their resilience that is not very strong, their cushion ability to withstand some adversities in life. What research have shown is what we call early childhood adverse events. All these could have negative impact even without the person knowing. And so the issue of child abuse, trauma, violence, neglect, social isolation, loneliness, and of course, something as that you may look as trivial as bullying. Bullying, and for a lot of people that went to boarding school like you guys and myself, the truth is that bullying has a lot of negative impact on people's mental health, both in the immediate and in the long term. And people may not know this, and that is why that we are having this strong campaign against bullying in school, because it has a prolonged long-term effect on people that are the victims. And of course, for also people that work in very combative setting, you talk about the military people and people that find themselves in areas of conflict, even without them knowing, this has entered into their subconsciousness. And you have quite a lot of people that are having PTSD, or maybe they have lost their loved ones in a very sudden and very maybe traumatic manner. And so people will be having what we call PTSD, post-traumatic stress disorder, in which the person is always reliving the experience of the bad thing that happened. And they try as much as possible that anything that can remind them of the thing that happened, they try to avoid them. But as much as they try to avoid any sin or anything that will keep them that will keep reminding them of those sins, they still have flashback. They have flashback, which is like intrusive, vivid image of what happened. And you will find these people that are very, very sensitive, always on edge. And for people that have PTSD, it's just like birds of a feather flock together. You will more often than not find comorbid depression and anxiety among them. And so, under the psychological factors, these are not exhaustive, but these are some of the risk factors. And on the diathesis stress theory, I think I have spoken to it earlier, in which I say that all of us are vulnerable. So instead that abnormality itself is not inherited, but a predisposition. We are all predisposed. We are all vulnerable. But it is how life events present to us and how we are able to weather it. And that is the stress. All of us are vulnerable, but when stress is loaded upon us, how do we respond to it? So you will see some people that little stress, therefore like pack of cards. And you have seen a lot of people, maybe someone that, maybe lost 50,000, 150,000 or 200,000 and said, he wants to go and commit suicide. Or someone that is a girlfriend, maybe his girlfriend duted, and is someone that is an insecure person that has tied everything to that person, and maybe is someone that have had a negative early life event, maybe neglected by the mom or suffered from some emotional detachment. And so this person is insecure, will always want to latch on to someone. And so if a very significant person in their life threatens to leave them, they feel insecure. And that's why you will see someone that say, my boyfriend duted me, and then they write a suicide note, I'm ending it. Or the same thing about if you turn it inside outward, even for men too. And you have seen somebody that holds somebody like 200,000 and they want to go attempt suicide. Whereas there are people that are holding millions or hundreds of millions. And they will say, well, you can't kill me. If I'm alive, I will pay your money. But so what makes the difference between somebody that's owing hundreds of millions and is not thinking of attempting suicide? and someone that is owing just 100,000 or 150, or someone that just feel down, or someone that has an extra year in school and feel left out and then decide to end it. So these are the issues. It is about how people, what is the resilience of people? How vulnerable are they? How strong, how resilient they are. Your vulnerability is how you are able to cave in to prayer, while your resilience is your withholding power, your staying power. And so this is an interplay of what constitute a that is a stress theory. So you see, the genetic predisposition, we all have genetic heredity from our parents, which of course some will be expressive, some will be dominant, some will be recessive. But it is when trouble comes that they tell on how we are able to, what is our level of resilience. So someone has genetic predisposition, there is childhood trauma, which constitute the vulnerability to someone coming down with mental disorder. So if this person have low genetic predisposition and has no childhood trauma, you will know that there is the lower probability of developing a mental disorder. But if someone has genetic predisposition and has childhood trauma, it will have a higher chances of coming down with mental disorder. Even if you have two people have low genetic predisposition, but the other one has childhood trauma, that person is more likely to do what? Is more likely to, is more vulnerable to developing mental disorder. And so, as we talk about mental distress or mental disorder, that so how do we, what are the signs, what are the things that we can pick? So it's not what you see on the street. Those ones are psychotic and they just constitute just 1% of what constitute mental disorders. But how can we detect? How can we be suspicious? How can we have a more heightened index of suspicion? What are the things that we can look out for? And the thing is about mental health is that it's a behavioral thing. It shows in the behavior. And so the commonest out of it is insomnia, poor sleep. Of course, there could be excessive sleep, but that is an exception of the rule. But for someone that may have a mental health challenges or that is brewing up, it may start with change in sleeping pattern. Poor sleep, which may be, late onset of sleep. I just find out that I can't sleep on time. Or I find out that when I sleep, I wake up in the night and I find it difficult to go back to sleep. That is insomnia. And of course, confused thought, muddled up thought, which of course our thought is what reflects in our speech and our speech, and then in our behavior too. So there can be change in behavior. And so what do we mean change in behavior? If someone that is very outgoing before, that check on people, and you just find out that the person just withdraw to himself or herself, not hearing from the person, or the person become very, very suspicious, let's go out. No, I don't want to go out. I never feel like, of course, it's okay not to, to feel like not going out, but when it becomes persistent and you know that this is a deviation, just like I've said, what constitutes an abnormality? A deviation from the norm, the duration, how long has it been there, and then dysfunction and distress. Once you are able to look through and on a deeper dive, and you will see that, there are some changes in this person. It's not as functional as before. This is not you, Tunde. That's not how you behave, So these changes in behavior, of course, can actually pass away without noticing, except with you are very close to the person and you are able to pay attention. But the unusual experiences are not that one cannot be hidden. You know, hallucination is like it's a misperception. What is not there, and the person feel that he is seeing or is hearing. We call that hallucination. But that one is the hallmark of psychosis. Oh, I hear people talk about me. They are abusing me. They said they want to harm me. And delusions, having very strong, most of the time, false belief. And this belief can be in different form. But for people that are having unusual experiences, these are not very hard to pick because they are very vivid. And that shows that the person is psychotic. Oh, I am this, I am that, and claiming what they are not. Or so what we normally see in those areas is either grandiose delusion, the person thinks bigger than himself or herself, who he is. Oh, I have billions, I can do this, I can do that. Or suspecting people. Oh, somebody want to poison me. My boss is this, my boss is that, you know, and quite a lot of people, they might, it will change. I mean, it will cause change in their behavior. You give them something, they become suspicious, they don't want to take it, they are reluctant, they feel unsafe around people. These are some of the things. Loss of concentration, changes in mood, prolonged sadness, changes in the functioning of the person, you know. So, and how do loss of concentration comes in? How do they play out in the office, in the place of work? So what you find out is someone not delivering on his or her task, deadline upon deadlines, not able to deliver on job, you know, and this is someone that is very tapped before, that is on top of his or her game, always delivering on time. And so most of the time for the bosses, when this happens, the first and natural response is, oh, what is wrong with you? Like you're not delivering on your job, not from a very, it's usually from a very negative perspective, not from the perspective of, I hope everything is fine. Do you need help? Are you going through some challenges? But more often than not, it's usually from the very other hand. And so I have this very unfortunate incident that while I was even doing my residency in psychiatry, unfortunately I lost a colleague that we were working together. She was also doing residency. But something is within I just discovered that we were both of us working at emergency at the time. She comes late. And you know, at times the nurses will just be complaining about her documentation. You know, she will be missing a lot of gaps, lacunae, you know. So, but of course, we are at the same level. At times I help her with the work, but I was not still very, I was not very, we were just starting residency together then. But our bosses they were seeing her as a lazy person, you know, and they were just complaining about her. Unfortunately, she committed suicide. And you know, that's an irony that someone commits suicide right in a mental health institution. It was after a suicide that everybody was now trying to do a postmortem analysis of what happened. Oh, and they will say, oh, maybe this was it. But it was already too late, you know. So, and this is for a lot of people that are going through a lot of mental health challenges, are struggling in silence. They don't want to talk because because of the stigma that is associated with it. And more so with men, it has been shown that anyone that commits suicide, most of them, very few percentage of suicide is the one that is what's it called, that was unplanned, that has never come, that was impulsive, that was never thought of or planned. Studies have shown that one way or the other, people will have showed signal even in the last 6 months. I don't want to bother you with this, but I think it's just for general knowledge to know that 50% of mental health problem start by the age of 14 and 75% of them by the age of 24. So it's what is worth paying attention to. But people, nobody talk about this. And when they say, oh, a 13-year-old or 12-year-old is having mental health issue, oh, they will say abomination. That is something for the adult. So what are examples of mental disorder? Schizophrenia. This is the one that is one of the commonest psychotic disorders, in which the person have a split mind, thinking somebody is after his or her life, monitoring, want to harm him or her. Depression, which is characterized by low mood, feeling sad, low energy, loss of interest in what people would normally enjoy. Anxiety, there are different types of anxiety disorder. Anxiety is just being afraid of nothing so much in particular. We have panic, you have panic disorder too. Under this, we have the bipolar affective disorder. I've talked of PTSD, and these are just common examples, but let me not bother so much with them. And so what do people say about mental distress or mental disorder? They say, oh, mental illness is synonymous with madness. Even if I've asked you guys to give your own perspective, maybe people will be saying mental, madness, and different things like that. But so these are the people that you call mad are just people that did not receive treatment on time, and then they are walking around in the street. Depression is a sign of weakness of the mind or a person. I've had people say, just put yourself together. Don't allow this depression to weigh you down. As if the person submitted himself or herself to depression to weigh down. And that is a result of course, demon, spiritual attack. And you know that also that those who have substance abuse problem is a mental disorder. Of course, there is a social perspective to it, but it's not when someone that need help, you are taking it as, oh, this is someone that is from a failed home. The parent never took care of him. They never took care of her, But the truth is that their biological basis to substance use problem. And that's why even when we want to do treatment for people, it has caused some changes in their brain, in the reward center. And so the list that you can keep them on admission for someone that is already hooked on drug is at least 90 days for some of the restructuring of the brain. And when they say people that have mental health challenges, they never get cured, or those who have mental health challenges can never live a normal life. I've seen professors with mental health conditions. There are presidents of the world that have led best of the countries in the world that are living with that were having mental health conditions that are still living with it. Abraham Lincoln had bipolar affective disorder, most of the time with depressive symptoms. Winston Churchill of the United Kingdom that led to World War II, I think, also had bipolar affective disorder. People can live a normal life. And even when we put people, it's not everybody that have mental distress or mental health condition that need medication. And when they need medication, there are people that we've managed successfully and then we have to discontinue their medication. And so the treatment for mental disorder is biopsychosocial. There is the place for pharmacotherapy, which are medication, and there is the place for psychotherapy. But it's because of all these myths that have been a barrier to people assessing even mental health when they need it. And so as I will be rounding up very soon, I feel that it's just good that I just speak to this on why men's mental health. And so the truth is one of the commonest things and of public health importance is suicide. People that die by suicide every year, more than 700,000 die by suicide. Now, you don't use the word commit suicide. You can say die by suicide, take their own life. So it is bad reporting for people to be saying, oh, committed suicide. So the truth is, most of the suicide committed annually is by men. Women make more attempts, but men do what? They are more of completers, and they use more fatal means. But the truth is, and if you are talking about substance use disorder, it is more among men. If you are talking about intellectual disability, it is more among men. But the truth is that the society does not allow men to be manly enough to come for help because of the stigma associated with mental health. That's number one. But specifically for men, there are so many things we can talk about men, but there's so much demand on men. The pressure on men is one of them that make them very vulnerable to coming down with mental distress. And of course, they'll say strong men don't cry. Men don't cry. It is only weak men that cry. And so someone that is going through depression, that is going through a lot, they are bottling it up because the society does not give them room to be human. You are not man if you cry. You are not a man if you seek for help. And this does not only apply in mental health, but in health generally. So if you are talking about service utilization, health-seeking behavior, men rarely seek help. And that's why also even a lot of cancer in men, they are detected very early because they don't seek for help. Even when they're having symptoms, they keep it to themselves. They will try to rationalize it. And apart from that, one other thing that also make it very important for us to talk about men's mental health is because men don't socialize as easily as women. And socialization is a very, very good and important protective factor for mental health. The more cohesive the society is, the more cohesive a community is, the better their mental health outcome. Can you see that in UK, in US, where they seem to have all the money and all the infrastructures, but the truth is that there are quite a lot of mental health conditions compared to here. Why? Because theirs is an individualistic society. Everybody is just living on their own. Interaction minimal. You can be living on a street with someone for 6 months or 1 year. And what? You may not see each other, you may not know each other's name. When I was doing my master's in the UK, I'm not sure I know one, I'm not sure I know 2 people on my street. And I can count the number that I greeted people that they answered me. So, but here, our communal life, the we thing, is helping our mental resilience. But now, with a lot of things, with globalization, with social media, we are losing that. People are now getting more isolated. We are now moving from a communal life to individualistic life, and that is impinging on our mental well-being. So as I begin to round up, what can you do for your mental health? Stress management. Stress is good for everybody, but how much of stress is what it is, and how do you manage stress? Good dose of stress, and when you know how to manage them, can make you productive. Imagine a world without challenges. So challenges drive us. Champions use challenges as breakfast, but how much of stress are you able to withstand? Stress is load. So how much are you able to load? How much are you able to withstand? Stress, and there are different sources of stress: workplace, home front, and many others. So take time to do something that is meaningful, relaxing, and fun to you and your social network. Of course, everybody will be saying now, Omo, you got to wake up. So people are hustling. People are hustling and do at the expense of their health. Oh, we must make ends meet. And so that is telling on people's mental health without knowing. You know, well, there's what we call flight and fight. When there is danger, there is what we call stress hormone that are released. And that's what makes you, in the face of danger, to be able to escape. People run, they jump fence in the face of danger that they will not be able to do ordinarily, because your body press an alarm that there is fire on the mountain. And once you're out of danger, then everything return to normal. But imagine something that was supposed to be for emergency. Your body now is under alarm all the time. That is what chronic stress does to the body. It puts your system on perpetual alarm and you be on edge. And when you are stressed and you don't take care of it, it affects every part of your body. And it can even lower your immunity and get you more prone to having sicknesses. Things as simple as getting enough sleep, consider being very emotionally intelligent. That is a big talk on its own, which we cannot talk about here. But when you are aware of your own emotion and that of others, and you use it to manage yourself and your relationship with others, that is the summary of emotional intelligence. Lifestyle of gratitude, goal setting. Now, when we say goal setting, it must be realistic. It says SMART goals. And in the new book that I read, they talk about making it smarter. Apart from the SMART, that must be specific, measurable, actionable, then make it exciting. Make it exciting. And I can't remember the last one. You know, so, but there are people, because you said set goals, they don't set the goals that they're setting is now constituting stressor for them. Because what? Because they are setting more than they can achieve. Their goals are not realistic. So learning to say no, sharing tasks, exercise, sleep hygiene, music. Exercise has both mental health implication and even on our physical fitness. I think a lot of us, I don't know, from the introduction, not so many people are working in the military distance. So the power to say no, people will bring so many things to your table. But if it doesn't work with you, if you know it's going to constitute stress, there is a way you can say no politely, and you will be helping your mental health. Having a good social network, joint family activities if you're a family person, and depending on your religion, prayers and meditation. And if you are talking about mindfulness, which is one of the interventions that also help our mental well-being, these are things that are based on the principles of meditation. So if you are a Muslim, if you are a Christian, prayers and meditation especially can help your mental well-being. And of course, going to religious houses to perform your religious duty has also been found to be good protective factor for your mental health. Religious activity, religious belief is also, it's a double-edged sword. There are people that have used religion and all they do is prayer, even when someone has mental health problem. But the truth is, religion has its positive side. Pastoral counseling, is helpful, and believing in life hereafter also give people some hope, even when they are going through some adversity. And also knowing when to seek professional help is very, very important. So if you want to help yourself and others as a group of people, you need to know more about mental health, improve on your mental health literacy, lend a helping hand. There's nobody that cannot help anybody. You may not work in the position of a professional, of a mental health professional, but being there for people, being ready to listen to them, saying, creating time for them genuinely will make them feel concerned. I have seen clients that come to me, just for follow-up, and I engage them. And at least I've seen 2 or 3 in recent time. And they told me that, oh, actually, I've been thinking of committing suicide, even over the next few days. But with the way that you have talked to me, I'm going to stay on. And you could ask, once you learn the helping hand to people and you know that this is not something you can undo, link them up to the right services. And even talk to people. They may say, oh, don't talk to people, don't talk to people. But do you want to talk to others after they have passed on? Or talk to someone that can be of help so that they can still be here together for a longer period of time and then be able to achieve things in their life, and for them to auto reverse and say, oh, thank God, what if I have done this? What if I've ended my life? And I would have seen at the other hand that there was so much more that was still lying ahead for me to do. And of course, changing the conversation, normalizing the conversation around mental health. That's not about madness, not about substance abuse, but what can we do to prevent mental health challenges? How can we promote our mental well-being in our personal space, at home front, and even in our workplace? A lot of us are in the corporate world, but we could allude to the fact how toxic even the corporate world can be in not taking care of the mental well-being of staff. Because just like children go to school, we spend at least about 1/3 of our adult life working in a place. And that place can constitute either a risk factor or a protective factor. So thank you so much. These are just the little thing that I have for you guys, and happy to take one of your questions. Thank you.
Okay, thank you very, very much, sir, for the very, very productive talk you have had with us on this very important subject. I think I can just put it to the house. If you have any questions, you can just indicate by raising up your hand. Okay, so before they get there, I actually have a few questions of my own, so let me start. So during your presentation, you mentioned you mentioned some of the signs to look out for, and I know going from that, I was trying to picture that as a practical example. So say like as an association now, we have a member that I have noticed has had a change in behavior. Maybe he used to be an active person and all of a sudden has become withdrawn. And I reach out, and the initial answer, as you've also pointed out, men don't normally open up as easily as women. So the initial feedback I get is, I'm okay. Are there any strategies or ways I can get that person to be comfortable, to be able to open up if there is indeed an issue? That's my first question. And my second issue is, say I finally get him to open up and he gives me an answer, say like, no, it's just work. I'm too stressed at work. What other steps or kind of conversations should I be having with that person to help them? Okay, so those are my two questions. I don't know if you can just shed more light on that.
Yeah. So how do you engage a person, that just give a casual answer, I'm okay. So the thing is, what you where you have not deposited, you can't withdraw from. So the thing will be like, there need to be a good existing relationship. If you are trying to form it during the time of crisis, people build walls, but they have, so and that still speak to that connectedness, the brotherhood thing, and that you create a very conducive environment that people will want to talk, or even before getting to them, that they can even beep you, oh, I need to talk to you. So if that is there, they will be more open to talk. And if that is there that they are not talking, then the truth is they will always have someone that is near to them. So, oh, can you check on this person? Can you just say hi and see how he's doing? So I think that would be my answer to that. And again, if the second level that you put it, if someone, you engage the person and the person alluded to, oh, I'm going through some of this stress. So the truth will be like, okay, if we identify those stressors with you, will be, where are these stressors taking place? So is it at workplace? Is it at home front? If it is at home front, then so what about the significant others in this person's life? So can you get to talk to this person to have this discussion with the significant others? So that's one thing. And then you can give some counsel on how to handle it. If it is in the workplace, and again, that's another thing. If it's in the workplace, the engagement may be more difficult. You can't engage as a third party on behalf of the person. But that again brings the issue of the self-esteem and assertiveness there. You could have a boss that is bullying or that is harassing you, that puts you in a very precarious position, give you job without description, without expectation, very ambiguous and uncertain environment at the workplace. Then it may be a time for the person to seek for redress, maybe make a complaint, and also request for some things, to say that, and so this is it again. I say, oh, if you say, oh, it's affecting my mental health, they say, okay, what's that? So there's still need for increased literacy and awareness in the workplace. And I have seen a woman, I'm not advocating for that, but the woman was heading a school and she was doing very well with the school. But of course, when she knew that it was telling so much on her mental health, and that the school will not do anything, with her husband, she decided to resign from the work. And so that, because your mental health is more important than the work. But I've also seen a lady that had depression, and they were almost going to sack her, and then what they call. And so she's not been to work for a couple of weeks, running to months, and they were going to stop her salary. Then they get her to come and see me, and I discovered that she had depression. And so what we did was to speak with the boss, maybe because me, I'm a professional. And so I said, this is what your staff is going through, blah, 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 blah. And then, can she be coming to work for 3 days? Coming to work for 3 days in a week? Can they adjust her schedule and thoughts and things like that? And that was it. And then she got very good, returned back to her job, and everything was fine. So these are some of the things that can be explored. Thank you.
Okay, thank you very much for Answer, sir. I think we have some questions in the chat. The first is, okay, for some men, when they open up, people tend to mock them, which is why they resent opening up. How do we deal with those kind of situations? And the second question is, are there any active emergency lines one can use to get in touch with when in suicidal situations? If yes, can we get these contact lines? Thank you.
Yeah, sorry, I had to. So if there are hotlines, right?
Yes.
When people need so there are hotlines. There are some in Abuja. The truth is that as a national mental health program, we have not done a mapping of those lines, and we are trying to do that and harmonize so that at national level, when there's an emergency call, then wherever the person is calling from, the state, then there will be someone that will be able to offer that help. But I know of suicide, suicide research prevention initiative in Nigeria. They're in a couple of states. I think most of the states, but they do not. I do not have a catalog of their this thing. And I know of a Sunshine series here in Abuja, and that one is linked to the national call center and a host of others. But honestly, I do not have them at my fingertips. But I could do a collation of some, and I know that there are private organizations that are running mental health services too, and that provide those services free of charge. I could get some and then forward to you.
Okay, thank you, sir. That'll be very helpful. So we'll just follow up with you and see if we can get some of
The
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 suicide
issue
lines.
of the issue of the mocking of men, I discussed it that so we need to be manly enough and we need to change the narrative. It's okay not to be okay. And it's okay for a man because if you bottle up things, that's what happens. People bottle up things until they get to crisis point. And by that time it's almost late, if not becoming late, if not late already. So I believe that we are the one that will change this narrative. And just last month is the Men Mental Health Awareness Month to raise awareness more about the need to pay attention to the mental health of men. You know, so we care for everybody. Nobody cares about us. Just like uh, just like Michael Jackson said, all I want to say is that they don't really care about us. So we need to care so much about ourselves, and we are the one that will change the narrative. We must keep talking about it, and then we normalize the conversation. Thank you.
Okay, thank you, sir. Okay.
And somebody said looking at Air Force military school and all the bullying. We have talked about that.
Yes, sir.
It
I've
can
actually faced
affect.
it.
It can affect people. Yes, it can be. It can be a foundation, underlying foundation. It affects people's resilience and their ability to cope with adverse life events later on in life. So it can be a predisposing factor. Thank you. I believe that's all the question, or do we have others? Hello?
Okay. I'll take the silence to mean we don't have any more questions and everybody has understood. Thank you once again on behalf of the Exco and of our association for taking out your time to have this talk with us. I know you're a very, very, very busy person, sir. But I really appreciated the fact that you were able to just dig out this time to educate us on this very, very important subject. Like you rightly mentioned, this being an alumni of children from children who went to military schools, we fall under, I would say, the subsect of people that are already predisposed, coming from the environment we had through the course of military training. And for our members who happen to be serving within the armed forces. So we really appreciate, we want to appreciate more these sort of subjects and just learn and know how we can improve. From what you've told us, I know an important factor you have mentioned is the importance of having a strong community as a guard against being vulnerable. So I think it's a message, it's a lesson we can all take, at least as a foundation. Having a solid relationship with members would help us be able to identify some of the vulnerabilities shared. And if we identify anyone who needs assistance, we can always, as they say, be your brother's keeper. So we would also like to ask, I know I've had some requests here for the presentation slides. So I will ask you maybe if we can have the slides. So it's made available to members really to go through and review what we have learned. I think if there's nothing more, I don't really have any other announcements.
I'll get back to you on that. It's okay.
Okay. All right. Then thank you very much, sir.
Yeah.
Yes, sir. For the I don't know. So do we need to do the introductions again for the people who are not here?
No.
All right.
No.
So, okay. So we've already done introductions. Sorry, we did introductions at the beginning of
I
the
can
presentation
leave now, so you guys
this
can
time.
continue.
All right.
Bye.
All right. Thank you very much once again, sir. I'll get back to you. I can just leave us with.